I am not a dental person. I spent most of my career in broader health policy reform, working at the World Bank, the World Health Organization, and almost came by accident to this area, which was a good thing because I think the contribution of rigorous research and data is incredible right now in oral care. Specific to the seniors issue, certainly in my group in the Health Policy Institute, we recognize and observe a lack of high quality data on oral health outcomes for seniors and access issues, and we've really upped our research program in that area. And I mean, we can talk more details, but the data to me speak loud and clear that there are access challenges for seniors when it comes to oral health. Here's why I think it is an access issue. So we recently released a very large-scale study called Oral Health and Well-Being among U.S. adults, and seniors are included. And a couple of things we found were when you ask people about do they value oral health, do they think it's important, do they think regular dental visits are important, overwhelmingly the vast majority of people say yes. So those data to me suggest that the value proposition in people's heads is there. When you get to now paying for care and accessing it, that's where you start seeing issues. So we do know that the top reason seniors don't go to the dentist more often is cost. And that's a combination of, I don't have insurance, it's too expensive, I can't afford it. So I think that's why today's discussion, the 2 days discussion about a benefit is actually, to me, one of the first steps we should be discussing. With that said, of course, oral health literacy programs and services that help connect patients to dentists, those are all important. But I want to be clear, to me, the major constraint is financial, and that's not going to be solved necessarily with any sort of education. We're talking about things like expanding coverage. So there, I mean, my personal views, yes or no, are, I think, less relevant. As a good disciplined economist, I mean, our job is to say, here are the consequences of this approach, and here's the consequences of this approach. So to me, again, the lack of a benefit in Medicare is one major roadblock, keeping seniors from better oral health and better life, better eating, better social life, better just quality of life measures in general. And so I think, yes, it's easy to say, you know, a benefit is a good thing. I think where the rubber meets the road, Steve, is really what do you mean by a benefit? And that is, you know, today's discussion was getting into that, and it's, you know, it's quite complex. You know, for example, we know the standard private dental insurance paradigm today that's in the U.S., which is a long 30, 40-year history. In my view, that has significant shortcomings. We know that people with typical private dental insurance today still face significant cost barriers. And insurance shouldn't be doing that. It should be relieving those barriers. So yes, I do feel there's some inertia certainly building on putting a benefit in, but I really think we need to carefully explore how would you design this? A little bit free from the status quo and the 30, 40-year history in this world, so that it actually pays for oral health. And that's the exciting part. I think that's where folks like me have a lot to contribute in terms of the data. Again, in my view, yes. And, you know, I think part of the contribution of the Health Policy Institute in the last 2 years has been to put some new data. For example, we know, as I was mentioning earlier, we looked at some of these quality of life measures, and I just want to give a few. So we know that almost 1 out of 5 low-income seniors say regularly and consistently they have trouble eating because of the condition of their mouth and teeth. Not occasionally or sometimes, but frequently, very often. Okay, that ought to be a cause for concern. We know things like dry mouth and even anxiety over smiling are also very prevalent. So when you combine that with the data I was mentioning on financial barriers, to me you get an extremely compelling case. One other piece of data that recently has been published, both out of my group and the Health Policy Institute, and in the Household Well-Being Survey from the Federal Reserve, is when you compare dental to other healthcare services, prescription drugs, mental health, primary care, hospital care, by far dental stands out as the service with the most acute cost barriers. So by far, dental care is the most likely service people will say they avoid or can't afford. And that to me is another point that says, you know, wait a minute, we've kind of just had this large healthcare reform. Let's put a lot of primary care services into an essential basket. But dental has still been kind of left on the margins, and I think we've reached a point where, in my view, the data are compelling that I don't think policymakers want to see that sustained that way. They want to do something. Those are two separate questions. I mean, it is part of overall health. You know, we had a big Surgeon General's report in 2000 that says that. I don't think we needed something like that. It's obvious when people are in pain and can't smile, speak, chew. You can't be healthy, right? Now, the second part is, should it be core primary care? Again, in my view, given all the linkages we're seeing between oral health and the rest of your body and the contribution oral health can make to well-being and lifestyle and even getting a job in terms of job interviews, I mean, this to me is kind of a no-brainer. I mean, and we're hitting so yes, I think the one challenge is you have a long history of a primarily siloed financing and delivery system that doesn't talk well with the rest of medical care. But I do feel, given the direction healthcare is going in the U.S. and the large health reform we're in the midst of, I think there'll be more and more opportunities to move dental care and oral health closer to primary care. Yeah, so again, I don't have hard data on this, but the kind of HR, finance folks I talk to on kind of Wall Street or Main Street firms, you know, to me, the answer there is no. I don't think they put a lot of thought into what exactly is the benefit plan they're purchasing for their employees. And frankly, I mean, I'm a PhD economist, and it took me a long time to just understand how dental benefits work and what do the numbers mean when you crunch it all. How much are you paying in benefit premiums, co-pays, and co-insurance versus the actual value of the care? You know, interestingly, we did a study where the conclusion we came away with was for the vast majority of adults, you actually end up paying more in premiums and co-insurance and co-pays than the market value of dental care consumed, which would tell me, look, if the very smart people put these numbers together, you would say, well, maybe there's a better product out there we can get for our employees. So long story short, I don't think as much thought goes into this as we would hope. Obviously, healthcare costs are the big driver of those decisions, and from what I understand and the people I talk to, the decisions on what type of dental benefit package, you know, to me is not. We should hope they put more thinking and analysis into it. So my take is that evidence base is not widely known in both the employer community and even in the physician community. So I agree with you. I think, you know, and we've heard this today here, a lot of the papers and stuff. I definitely feel that is underappreciated. And we do have emerging evidence. It's not perfect, but again, my take as a health economist is that, you know, to me, there's enough out there that you can demonstrate that there are cost savings on the medical side, certainly within certain groups like diabetics. But I agree with you, I do not feel that evidence base is widely known out there. Yeah, I guess I speak from the perspective of a health economist, and you know, kind of the mission of our group in the Health Policy Institute is really to put data and evidence that helps inform decisions. And so, we've talked about this. I mean, my view is this is an area that has needed a lot more rigorous analysis, simulating policies, estimating the cost, for example, of a Medicare dental benefit. I haven't seen some really good analysis on that. I think that's vital. So I definitely feel that, and it's not just me, there are other groups around the country working on this. There's a critical role to put health economics, health services research, and fiscal analysis into this debate. I think it can absolutely strengthen the case.